Hi, my name is Janet Chesnick, and I'm an LPN and a student nurse. I am currently working on my RN and BSN from Indiana State University. This video is part of a series of 7 videos that I'm making for my community health nursing 444 class. I also work as a triage nurse for a pediatric primary care office. So each of these videos is going to discuss a different topic that I'm asked about frequently as a pediatric triage nurse. The population at risk that I'm addressing is pediatric patients and their parents. Before I begin, I do want to emphasize that this video is informational, but in no way should replace consulting with your own pediatrician. So, one of the more common topics that parents ask me about is depression. It's important as a parent to know what depression is and how it can manifest in a child or a teenager and what to do about it. So the learning objectives for this video are: what is depression? What does depression look like in a school-age child? What does depression look like in a teenager? What should you do if you suspect that your child is depressed? And when is depression an emergency? Attached to this video is a pre-test if you want to quiz yourself before you continue. Also a post-test for after, as well as a handout with links to find out more. So let's get started. So what is depression? Depression is more than just feeling sad. Everyone feels sad from time to time. Depression is actually a chemical imbalance inside the body that makes a person feel sad or low energy, agitated, or even quick to anger. And this lasts for more than a few weeks. It can last for months or even years. Some people have to fight it their whole lives. Is caused by an insufficient amount of neurotransmitters, or these chemicals that send messages between your nerves. And these neurotransmitters help people feel happiness and have a higher threshold for stress. Depression can be caused by trauma, both physical and emotional, or for no apparent reason at all, especially if there is a family history of depression. Parents are often afraid or embarrassed to talk about their child's behavior until it's gotten out of hand. This could be because there is a stigma around mental health, but ignoring the symptoms can mean the difference between life or death. So it does need to be taken seriously and treated. So what does depression look like in a school-age child? Younger children can get depressed, but it may be harder to see because kids do not have sophisticated enough vocabulary to express what they are feeling. Sometimes depression is seen as acting out or tantrums. Other times, the child just may seem disagreeable with everything. Even a day at an amusement park is not good enough to make them happy. Other times, they may seem extra quiet and have no interest in talking with anyone, even friends. As a parent, you may think your child is acting out, and while that may be the case, if this is a new behavior or a new pattern that you are noticing, it may be worth investigating. What does depression look like in a teenager? Teenagers can be a little tricky to tell if they are depressed, as not talking to their parents much and wanting to sleep all day and having an attitude are a part of their normal developmental stage. The biggest indicator is when there's a significant change in their behavior that seems to happen pretty suddenly. However, there are some kids who become depressed gradually, especially those who are more genetically prone to it. In either case, it's best to try to keep the lines of communication open. Teenagers can be dramatic by nature, so as parents, we have to remember to keep judgment to ourselves as best as we can and let them express themselves. If they feel they will be punished or ridiculed for opening up, the door to communication will be closed for a very long time. If they do confide something alarming to you, try your best to remain calm while you help them. The Cleveland Clinic lists several symptoms that we can watch out for in all children: irritability, anger, or being on edge, persistent feelings of sadness or hopelessness, withdraw from previously enjoyed activities as well as from friends and family, increased sensitivity or to rejection or criticism, changes in appetite, either increased or decreased, changes in sleep, like sleeplessness or too much sleep, crying or temper tantrums, difficulty concentrating, fatigue, low energy, physical complaints such as stomach aches and headaches that don't respond to treatment, reduced ability to function during activities at home or with friends, and feelings of worthlessness and guilt, and even thoughts of talk of death and suicide. So, what should you do if you suspect your child may be depressed? If you're worried about your child's mental health, there is help available. You can start with your pediatrician. They can recommend counselors, testing, or even a psychiatrist if it is ultimately decided that your child may benefit from medication. Many parents are worried about having to medicate their child. Typically, other treatments are tried first, like counseling and therapy. If these are unsuccessful or if your child's having more serious symptoms, then medication may be advised. Many kids need outpatient therapy services. These can range from a few times a week to once a month or even every other month, depending on the progress that they've made. There are many options such as play therapy, individual therapy, family therapy, and group therapy. For more serious cases, some children may need to do intensive outpatient, where they attend therapy daily for half the day to the whole day. And of course, there is inpatient for the most serious cases that need round-the-clock care and supervision. When choosing a mental health provider, you need to find someone who your child can feel comfortable with and connect with. The therapist will be limited in what they can share with parents as a part of developing this relationship and trust with the child, so the provider needs to be someone that everyone is comfortable with. And when is depression an emergency? Some depressed children start having thoughts of self-harm or harming others. They may or may not share these thoughts with others. Some children will start to make a plan with these thoughts. Other children are way more impulsive and can attempt suicide with no apparent notice. For this reason, if you have any concerns that your child may be thinking of hurting themselves or others, or if they have actually made an attempt, you need to get them help right away. It is an emergency. The Cleveland Clinic lists these as warning signs: severe depressive symptoms, social isolation, talk of suicide, hopelessness, and helplessness, increased acting out behaviors, increased risk-taking behaviors, frequent accidents, drug or alcohol abuse, focus on morbid and negative themes, talk about death and dying, increased crying or reduced expression of emotions, and giving away possessions. Many mental health providers have crisis lines that are available 24/7. If you're not sure what services are available in your area, you can call the national hotline for the Substance Abuse and Mental Health Services Administration at 1-800-682-HELP. They can help point you in the right direction and are available 365 days a year. If you need to get your child to immediate safety, take them to the local emergency room. Many emergency rooms have mental health providers on call for such emergencies. If you have more concerns about your child's health because you've seen some of the symptoms that are discussed in this video, or you just have questions in general, you definitely should consult your pediatrician. As a parent, you will become accustomed to what is normal for your child. So if you see changes and you're not sure if it's normal or not, call your doctor. I have a handout attached to this video for additional information as well as a post quiz. Thanks for watching.